Come on, come on. Almost there. Recess! Yes! Freedom is a beguiling mistress and her name is Recess! Woo! Oh, it feels good, right? The ultimate antidepressant in my book. I'm sure Roger Waters could have used a few more breaks throughout the school day, you know what I mean? I don't know what happened to that guy at school, but where were we in this chapter, by the way? Oh, right, antidepressants, of course. By now, whenever you think of treating depression, I want you to think of enhancing synaptic availability of monoamines. One of the leading hypotheses out there concerning the pathophysiology of depression is the monoamine hypothesis, which suggests that depression is related to a deficiency in central serotonin, norepinephrine, and dopamine. Just think of our SSRIs and SNRIs sitcom sketch. These drugs treat depression and anxiety by inhibiting serotonin and norepinephrine reuptake, thereby increasing monoamine availability in the CNS. And tricyclics are no different. At Sketchy, we represent tricyclic antidepressants with, you guessed it, a tricycle. What did you say? Just another nondescript schoolyard plaything? No. You see, that tricycle was abandoned there in no man's land because all of the lower classmen know that if you set foot inside that white rectangle, you're not going to make it out alive. Oh, you're playing for keeps, my friend. That is a dodgeball court. What? What's dodgeball? Dodgeball is a game in which players on two teams try to throw balls at each other while avoiding being hit by balls. Look, it's more complicated than it sounds, okay? It involves cunning and twisting and, artful dodging. And remember, our official mantra, if you can dodge a tricycle, you can dodge a ball. This is made painfully clear by Amy here, who seems to have forgotten the first rule of dodgeball and has just received some wicked chin music while tripping over that stray tricycle. Little does she know, she has just given us a perfect demonstration of each one of the TCAs. That imprint left on her face will remind us of imipramine and of its derivatives desipramine and clomipramine. Think of it as the imipramine imprint. Actually, that's not looking so good. You should probably put some Neosporin on that thing or something. It's going to get infected. Also, the fact that Amy is tripping over that tricycle should remind you of the rest of the TCAs, amitriptyline and nortriptyline. TCAs work kind of like the SNRIs. They inhibit norepinephrine and serotonin reuptake by blocking the activity of the norepinephrine transporter, NET, and the serotonin transporter, SERT, sometimes just called NET or SERT. Because serotonin is the hormone that makes you happy, our recurring sketchy symbol for serotonin is a smiley face. Like this one. And by now, you should recognize that north compass on the other ball. It's our recurring symbol for norepinephrine. So, as Amy tries in vain to pick up those dodgeballs before getting pelted in the moneymaker, let it remind you of blocked serotonin and norepinephrine reuptake, leading to increased levels of monoamines out in the synapse. While that sounds like it would be useful for treating depression, the truth is TCAs are now relegated to second or third line treatment for major depressive disorder. TCAs are potentially lethal in overdose, have serious drug interactions, cause numerous adverse effects. It's just not good. As a consequence, TCAs are now reserved for patients whose depression is unresponsive to other agents. At Sketchy, whenever we talk about the treatment of depression, we'll include a symbol like this one. The sad mask to remind you of the negative symptoms associated with major depressive disorder, and the happy mask to emphasize the goal of treatment, which is remission of all symptoms. In this scene, it's the logo for the drama club. But notice that Braden here is struggling with the door. Braden, overacting yet again. Way to ham it up, Braden! No wonder they're having a secret meeting right now to vote him out of the club. Anyway, as he struggles against that resistant door, just keep in mind that TCAs are pretty much used for treatment-resistant depression only. So I know they're called antidepressants and all, but I want you to focus on some of the off-label uses of TCAs. Let's start with the treatment of pain disorders. TCAs have been used in the treatment of neuropathic and other pain conditions since the 1960s. Just like with the SNRIs, the analgesic properties of TCAs are likely associated with their action as serotonin and norepinephrine reuptake inhibitors. So, both the SNRIs and TCAs can be used to treat diabetic neuropathy, for example. Kind of like the peripheral pins and needles this kid is feeling right now from getting his hand caught in that Dia-Sweeties machine. So worth it. Their role as antidepressants may come into play as well because chronic pain conditions are commonly associated with major depression. Look for a frayed wire like this one leading up to the machine whenever we talk about the treatment of chronic pain or neuropathic pain specifically. The tricyclic antidepressants are also commonly used for migraine prevention. Just think of that classic unilateral pounding sensation evoked by this head-shaped school bell. Amitriptyline is the only tricyclic that has proven efficacy for migraines, though other tricyclics may also have benefit. Recall from our SSRI sitcom that obsessive compulsive disorder, or OCD, is known to respond to serotonergic antidepressants. You remember Dwayne compulsively arranging the objects on his desk, obsessively on the lookout for Tim's next prank? Well, flashback 20 years earlier, and little Dwayne here is already showing early signs of his compulsive nature, meticulously arranging those marbles in front of him. It's too bad Tim, the school bully, has pulled countless pranks on Dwayne here, whether embedding his marbles in Jell-O or sticking them inside that vending machine. Not today, Tim, not today. In addition to SSRIs, one of the TCAs, clomipramine, has been shown to be effective in reducing the symptoms of OCD. Though, as we'll soon illustrate, the TCAs are generally less well tolerated than the SSRIs and are not first-line agents. Yeah, it's that extensive side effect profile that has relegated the TCAs to second or third-line status for most clinical indications. On the exam, emphasis will be placed on characterizing these classic adverse effects, so let's go through them now. First, take a look at the third grade teacher, Mrs. Pearson, over here. This isn't the first time the gym teacher has tried to hit on her. Ugh, get it together, man. Look, she's a sophisticated lady, okay? She's just not into dudes that wear shorts for a living. You better check yourself. And buy a pair of Dockers or something. At Sketchy, whenever you witness rejection like this, keep side effects in mind related to sexual dysfunction, including reduced libido, anorgasmia, and increased ejaculation latency. The most common adverse effects of the TCAs are a direct manifestation of their potent anticholinergic properties. Anticholinergic toxicity results from the inhibition of central and peripheral muscarinic receptors, kind of like how atropine works. And if you look closely, you'll notice that this errant dodgeball is disrupting a little tea party set up by a couple of the lower classmen. A tea party eerily reminiscent of our Atropine in Wonderland sketch. TCAs commonly cause many of the classic anticholinergic side effects such as dry mouth, constipation, blurred vision, urinary retention, and confusion. Just think of Atropine Alice's tea party guests. Hot as a hare, mad as a hatter, dry as a tea cracker, blind as a bat, and full as a tea kettle. It turns out that among the TCAs, amitriptyline has the most potent anticholinergic effects, while the secondary amines, nortriptyline and desipramine, have the least. Think of it this way. See this sign for the neighboring secondary school? Well, that's our symbol for secondary amines with decreased cholinergic effects. And the name Northside Prep should remind you of the TCAs nortriptyline and desipramine. As this student here cowers under the sign to avoid those potent tricyclic dodgeballs, remember that anticholinergic adverse effects including dry mouth, constipation, and urinary retention can be reduced by using these secondary amine agents instead of amitriptyline. This can be especially important in the elderly. These patients are at increased risk for side effects due to comorbid conditions, decreased hepatic and renal clearance of medication, and a higher burden of concurrent medications that can interact with TCAs. So, just like dodgeball, TCAs are relatively contraindicated in elderly patients due to an increased risk of sedation, delirium, and falls. You better sit this one out, Leonard. Your glory days are behind you. Oh, and when that elderly patient presents to your ER confused and mad as a hatter, it could be any number of medications causing toxicity. One of the clues that will point you toward anticholinergic toxicity specifically is that urinary retention. Maybe he's confused and dry and you had to stick a Foley in him to empty a liter of urine from his bladder. That's when you should start thinking of drugs with anticholinergic properties such as antihistamines or TCAs. So remember that little bladder-shaped tea kettle. TCAs are also associated with H1 histamine receptor antagonism. At Sketchy, histamine is symbolized by an allergy-inducing bee. Antihistamines, therefore, are depicted as a bee swatter, like the one wielded by this Dodgeball Pro over here. Surprisingly effective, actually. If you think back to that Midsummer Night's diphenhydramine sketch, you may recall that central blockade of H1 receptors can cause increased appetite and weight gain, as well as sedation. This list of side effects goes on and on. So far, TCAs have caused anticholinergic toxicity, histamine blockade, so why not some peripheral antagonism of alpha-1 adrenergic receptors? Sure. Our recurring symbol for alpha-1 antagonism is an extinguished alpha candle, like this one held by yet another casualty of this dodgeball offensive. It's sad, really. Just another statistic. It turns out that TCAs can exert potent alpha-blocking effects, leading to peripheral vasodilation and orthostatic hypotension. So remember to watch out for falls in the elderly. Not only that, refractory hypotension due to peripheral dilation can contribute to a fatal decrease in cardiac output. And that brings us to cardiac toxicity. Sure, patients suffering from TCA overdose will be experiencing some severe antimuscarinic, antihistaminic, and anti-alpha symptoms. However, it's the inhibition of myocardial sodium channels that can lead to fatal cardiac arrhythmias. The most common cause of death in patients with TCA overdose is fatal cardiac arrhythmia. Just think of these broken, heart-shaped peanut butter cookies scattered on the ground after a stray dodgeball has found its way over to the school bake sale. We've emphasized peanut butter cookies specifically to remind you of our recurring Sketchy symbol for sodium, those ubiquitous salty sodium peanuts. And if you think back to that type 1 antiarrhythmic sketch at the Heartbreak Hotel, you'll recall that fast sodium channels in the myocardium are symbolized by jars of peanut butter. We've even stuck a little spoon inside, kind of like that inactivation gate that swings closed shortly after these channels are activated. Blockage of fast sodium channels has deleterious effects on the cardiac conduction system, causing QRS and QT prolongation and fatal cardiac arrhythmias. Contractility is also depressed, contributing to refractory and potentially fatal hypotension. Just like with type 1 antiarrhythmics, the blockade of fast sodium channels decreases the slope of the cardiac action potential, thereby slowing action potential conduction through the myocardium. On the ECG, this is seen as a widened QRS complex due to increased ventricular depolarization time. Just check out the crack in that broken heart. Notice the shape of it looks like an ECG tracing. You've got the P wave bump, the QRS spike, and the T wave bump. But look at the size of that QRS. It's huge! The QT interval may be prolonged as well, which may precipitate a torsade de pointe arrhythmia and syncope. We'll represent this twisting of the points with a twisted party streamer marked with the torsade's ECG tracing. If a patient on TCAs presents with a widened QRS or ventricular arrhythmias, they've got to get sodium bicarb therapy. Sodium bicarbonate increases serum pH, which favors the non-ionized form of the drug, making it less accessible to bind to sodium channels. Sodium bicarb also increases extracellular sodium, which helps overcome the competitive rapid sodium channel blockade induced by TCAs. Just think of this little baker girl here who's had quite enough of this dodgeball tomfoolery. You want to play dodgeball, huh? Well, how about some Dodge baking soda? Yeah, that didn't really have the dramatic effect I was going for. I am going to need that back. Anyways, students often remember the 3 C's when thinking about the adverse effects of tricyclics, kind of like the 3 wheels of a tricycle. Cardiac? Check. Coma. Covered that one with the antihistamine effects. And lastly, convulsions. That's depicted here by our recurring sketchy action lines surrounding this dodgeball noob. TCA poisoning can cause seizures likely due to the antagonist effect of TCAs on the GABA A receptor. Look, it barely grazed you. No need to make it all dramatic, okay, Aryan Robben? Just look at yourself. And lastly, I just want to remind you that serotonin syndrome must be considered in any patient suspected of antidepressant overdose. Remember that many of them, including TCAs, affect serotonin reuptake, potentially causing too much serotonin to build up at the synapse, especially when drugs are used in combination. Patients with serotonin syndrome present with hyperthermia, autonomic instability, hyperreflexia, and myoclonus. Check out our SSRI sitcom for more. What? Already? Oh man! We don't need no education! I mean, what if I don't want to eat my meat? What if I just want pudding? Why can't I have any pudding if I don't